Hello, my name is Trista. I'm going to be sharing my course project for NU660, Healthcare Financing and Economics. My project is entitled The Caregiver's Corner. During this presentation, I will cover an overview of the project, the purpose of the project, outcome and goals of the project, and a detailed budget for the project. So for my project budget proposal, I chose to create a budget for the implementation of a new program for the caregivers of patients in my department. This program, which is entitled The Caregiver's Corner, would include revamping the family room currently located on our unit. Our family room is small with a TV, charging station, reading materials, water and ice machine, limited snacks, and a washer and dryer. Although the family room does have several amenities for families and caregivers, I hope through the Caregiver's Corner a more welcoming and inviting environment can be achieved. The current space the department uses as a family room feels very dark and most likely does not feel like a relaxing space for caregivers and family members. The paint color is a gray color at this time. I think a better fit would be a hue of blue or green to promote a reduction in stress and a cozier space. The furniture currently in the space is not very comfortable. Offering more comfortable furniture options would give caregivers a space where they are more likely to relax. Currently, limited snacks are available, and snacks get picked over fast when they are available. A better selection of snacks and drinks for caregivers as they utilize this new space would be an additional way to help caregivers feel supported during their stays. In addition, I would like to make to the family room through the Caregiver's Corner would be offering resources for caregivers, whether that be hospital resources such as patient advocate information or respite options within the area. Although not all individuals utilizing this space will be caring for a chronically ill person, caregivers with an acutely ill child still experience stress while in the hospital. I believe having these resources available will help all family members and caregivers feel more supported during their stays. Outcomes and goals. So the first one I want to talk about is stress reduction. Caregivers need a space where they can go for a break that promotes relaxation so they can continue to support their child while also ensuring they are taking care of themselves. I am hopeful that the Caregiver's Corner would ensure a peaceful place for families and caregivers to decompress, which in return can reduce caregiver burnout and stress. The second outcome I want to talk about is support. It is important that caregivers feel supported, and offering these changes to a space dedicated to them is a great way to show our support and appreciation. Creating an environment where families feel welcome and supported allows for families to feel more comfortable and relaxed to engage in care planning for their child. And the third one I want to talk about is resources. Resources for family caregivers available in the Caregiver's Corner will help with the incredibly demanding task of being a caregiver, which can lead to immense stress, burnout, isolation, and financial strain. And the fourth one I want to talk about is privacy. I want the Caregiver's Corner to allow a space for private conversations to be had when necessary regarding treatment plans and goals, which can be difficult for families to hear. In the current family room that we have, a lot of times when patients and their families have care conferences, that is where they meet. So I think just having a space that feels a little bit more comfortable will make those conversations a little bit easier. And now on to my budget. So I'm going to be talking about 4 categories. So the first one is going to be the personnel. So the only personnel requiring hire for this project will be someone to paint the room. The cost I estimated I got by utilizing a free quote from a painting company in the area. All other labor, such as redecorating and stocking snacks and drinks, will be done by myself or staff willing to volunteer their time. I think it's important that the room be painted to guarantee a more relaxing and calmer environment for caregivers and family members utilizing the space. So with that being said, the only thing personnel-wise will be contracted services for the painter, and that cost was $900, and that was including paint cost as well. So that would be for any paint utilized and the labor. And the second category is going to be supplies and materials. So educational resources, snacks, drinks, and then a small fridge for the drinks, new furniture, and then just some decorations to make it feel a little bit more homey. The main thing I was thinking of for decorations were just throw pillows for the couch. There are some already like small decorations available in the space that can be reused. So a small fridge to add into the room for more drink options in the family room. The cost estimation for the fridge was determined by just finding a fridge online. The fridge was a mini fridge, but it can fit 115 cans per the dimensions, allowing for plenty of options to be available for family caregivers. The fridge was also, like the front of it is glass, so they can see through it, which might help entice people a little bit more. And the new furniture is easily able to be cleaned while also ensuring comfortability. A small addition was made to the budget for decorations. Like I said, mainly just throw pillows for the furniture to create a more welcoming environment for families, since there already are decorations and pictures on the wall in the room that can be reused. Since paint cost was included in the estimate for personnel, paint cost will not be included in this estimate for supplies and materials. And then I actually found that free resources are available through the hospital, educational resources for family members, so I didn't have to add any additional cost for those resources. So the estimated cost for the snacks, drinks, the small fridge, the furniture, and then the throw pillows, I got an estimated cost of $1,180. And then the third category I'm going to be talking about is equipment. Mainly the only thing that we needed equipment-wise was just a new phone charging station. When looking at the phone charging station that we currently have in the space, it has several like broken adapters, so it cannot be used by families. Updating the charging station is just an additional way to provide resources for families, especially since we typically do not hand out phone chargers because they often get lost. It's nice to have an alternative to offer to families when they do ask for a phone charger. And to get the same one that we have in there right now, just because it works pretty well and it has a lot of options as far as cords, it's going to be $330 based off the price I found online. So that is how I came up with my estimated cost. And then as far as other expenses, I just wanted to create a small fund for replenishing the snacks and drinks that are available in the space. So at some point I would like to incorporate a fundraiser or some type of donation system for drinks and snacks. But for the present time, a small fund is needed to ensure that snacks and drinks are stocked for caregivers and families. Ensuring these amenities are fully stocked is crucial because hospital schedules disrupt eating schedules, making quick, nourishing options essential for stressed caregivers and families who often do not want to leave or can't afford to eat expensive cafeteria food. So just that fund, I estimated that we would be okay with like a $300 fund for the time being, until we can come up with kind of a fundraising or donation way that we can restock the food and drinks that we offer in the space. So based off of all of those estimated costs, I came up with a total estimation of $2,710.